Hi, my name's Chloe. I'm a student occupational therapist and I'm looking to understand more about allied health professions in a mental health setting. And I'm here with Naaman.
Hi Naaman, thank you for coming
Hi.
here today. I think you're going to be here telling us a bit about your job as a physiotherapist in mental health. So would you be able to tell us a bit about your current job at the moment?
Okay, so I am the physiotherapy lead based at Charlton Lane Hospital within mental health services. So Charlton Lane Hospital provides care for older adults suffering with mental health diagnoses.
Oh wow.
I offer support to the working age adults physios as well over at Wootton Norton Hospital. So that's anyone up to the age of retiring.
Okay. So you seem to be left, right and centre everywhere. So what does your typical day look like?
As a physio, we split our engagement into a hierarchy.
Right.
So the base of the hierarchy, we provide a replication of an MSK service, musculoskeletal outpatient service, outpatient respiratory service, and look at some safe discharge and home discharge. So we want our service users to be able to access services the same as you or I if we weren't suffering with a mental health issue.
Right, okay. And what about the other?
So that's where we move up into the secondary level, and that's where we look at kind of falls prevention, look at rehabilitation, specialist equipment prescription. So having a deep assessment into the patient's needs or service users' needs, and looking at what we can do to support them. And then the tertiary level would be where we look at the physical health manifestations of people's mental health diagnoses and presentations.
Oh, wow.
So physical changes that can happen in the body that we can hopefully support them with.
So what does your career journey look like up until this point?
So when I was at university, I worked on the bank for the trusts within Gloucestershire. Just working as an HCA or working in an admin role in holidays. I worked in paediatrics for a period. I worked in musculoskeletal outpatients for a period. Then found a job in mental health. I started as a band 5 and then underwent further training to specialise to become the deputy lead for physio services.
Oh wow.
Which was interesting. It's a mixture between management and clinical practice. And then onto my current position as the lead.
Oh gosh. So I understand that you've had a recent change in your role as a physiotherapist. Would you be able to expand on that?
Yes, so I used to work at Wootton Norton Hospital, which is working age adults, so up to the age of 65. Now I work at Charlton Lane Hospital, which is 65 plus. Both are under the mental health bracket, but in the older age adults, the prevalence of dementias is a lot higher. So we see a lot of Alzheimer's, Korsakoff's, Lewy body dementias and Parkinson's, whereas in the working age we see a higher prevalence of your functional mental health presentations such as anxiety, depression, schizophrenia, etc. With working in older age adults, there's a higher level of frailty, higher level of falls and falls risk, so there's a significant shift in focus to maintaining patient safety from that point of view, in addition to looking at rehabilitation as we would do normally. But another aspect of my progression has been in team management, team leading. So over at Wootton Norton Hospital, I was the deputy lead, so developed my skills around supervision and appraisal and supporting individuals to develop. And now I've moved over into the lead position at Charlton Lane. That continues to expand. That's supporting the team internally, so continuing to look at developing my team, looking at where the service should be focused and developing, and taking on students as well as part of that. I really enjoy taking on students. It's an opportunity for us to expose people to mental health and mental health services where they wouldn't necessarily have an opportunity to do before. And the other aspect is supporting the wider team, so supporting nursing staff and the medics to deliver holistic care to service users.
Why are physios so important in mental health?
I think all AHPs are beneficial in mental health, but physios specifically, mental health historically looks at the kind of head-up approach, but when we look at someone with poor mental health, there's loads of physical health manifestations of their mental health, whether that's impacts on their dietary intake, whether it's changes in posture related to their mood, whether it's self-injurious behaviour. There's a lot of avenues.
It's a very holistic approach. It's not just what's going on in their head.
We try and take a two-pronged attack. Look at the mind and the brain, but also look at the body as well. And I think there's a key role around rehabilitation. So people who have lost roles or their functionability has been affected, our role as physios is to look at how we can support them to maintain that independence and improve their quality of life.
Awesome. So what would you say to someone considering a career in mental health, physio or just in general?
Well, I would always say go for it. Being a physio I find it a fantastic job. I think it gives you an avenue to support people, so if you're like-minded. With regards to mental health, I understand that it's not for everyone, but if you like variety, so I found that in other areas that I've worked, although I enjoyed it and there's lots to learn, you do get into kind of a routine of seeing similar presentations. Whereas in mental health, pretty much every presentation is a new presentation. It keeps you on your toes.
You never know what you're going to
variety to work with,
Cool. Thank you very much for coming.
Anytime.